Breast surgeries are safe and effective. The latest surgical approaches and techniques are designed to be less aggressive, less invasive, and less traumatic to your body and to your overall appearance. All surgeries will have long-term impacts on your body. Part of preparing for surgery is understanding not only the risks of a procedure, but what to expect long-term. An important question to ask yourself is, what are my goals as to my appearance? In the past, the appearance of a woman's breast after breast cancer treatment was of minimal importance. It was all about cure. Today, although not a top priority, physical appearance and an ability to hide scars and improve cosmesis are very important to us as breast cancer surgeons. One of the first questions we ask ourselves when we see a patient who needs surgery is, how can I best hide scars and achieve a good cosmetic result? A very common concern about breast cancer surgery is the risk of developing lymphedema. Lymphedema is an enlargement or swelling of the arm or breast as a result of lymphatic disruption from surgery on the breast and lymph nodes. Fortunately, lymphedema of the breast is somewhat uncommon. However, lymphedema of the arm used to be an occurrence in over 30% of women who had lymph nodes dissected, which is the removal of 20 to 30 lymph nodes at the time of definitive surgery. Today, in most cases, only a few lymph nodes are removed for early-stage breast cancer. These specific lymph nodes are called Sentinel lymph nodes. The identification of Sentinel nodes allows the removal of the most important lymph nodes in the axilla or armpit to be removed for pathological assessment. Because so few lymph nodes are removed, the risk of lymphedema of the arm is less than 3%. Furthermore, assessment for lymphedema occurs with every visit post-treatment so that early intervention can occur at the first signs of suspicious changes before significant lymphedema can develop. Surgery may also result in a reduction of mobility, range of motion, and strength of the arm on the side of intervention. These effects are all perfectly normal and typically short-term. Healing from surgery causes scar tissue to form, and radiation, if needed, can cause this scar tissue to increase in the axilla or armpit. You may find that you just can't move as freely or flexibly as you could before surgery. Stretching and exercise, when deemed appropriate post-operatively, can recover the range of motion and strength back to your baseline. Yoga is a very good exercise that improves this flexibility and range of motion in a safe and effective manner. Your surgeon will instruct you as to when you can start to address any of these symptoms after surgery. Sensation in the breast can be altered after treatment. Specifically, after mastectomy, most women describe numb breasts, as sensation is typically lost. On the other hand, after lumpectomy, most women maintain sensation in the breast and the nipple areolar complex. There can be sexual side effects after your treatment. Surgical change in the appearance of the breast, along with alterations in sensitivity, can often lead to an adjustment period for patients and their partners. In addition, possible side effects from your other treatments, like radiation, chemotherapy, and anti-estrogen therapy, can lead to some patients experiencing challenges with intimacy and sexuality. It doesn't happen to everybody, but we have resources available to help. If you are experiencing sexual side effects, let us know, and we can determine what resources would be most appropriate to help you. You should always feel comfortable asking questions and seeking help for concerns you have post-surgery and following treatment. Our ultimate goal with any treatment plan is to leave you with as few reminders of your cancer as possible. Most importantly, we will follow cancer patients long-term in our Survivorship Clinic, run by one of our highly trained advanced practice providers. Survivorship involves guidance and intervention to help get patients back to normal. Survivorship is a critical aspect of breast cancer care. So, our team is here for you to answer questions, provide resources, and to support you throughout your treatment and your recovery.